Okay, so now we are continuing with non-steroidal anti-inflammatory drugs, part 3. This is the third lecture now. We started with aspirin and we are continuing with aspirin. So what are the therapeutic uses of aspirin? Because in the last lecture, we already discussed the mode of action, mechanism of action, pharmacological actions. So now, what are the uses of aspirin? The first most important use is analgesia. What is analgesia? To relieve pain. And what is integumental origin? That is arising from the viscera, like from the muscles. This pain is controlled by aspirin, and hence whenever this pain is becoming very much severe, then it cannot be controlled, and then we have many alternative drugs for the severe pain. But basically aspirin is used in toothache, headache, myalgia, arthralgia, neuralgia, and dysmenorrhea. Myalgia, you all know, it is pain in the muscles. Arthralgia is pain in the big joints, and neuralgia is pain in the neurons or neural origin. Then it has got anti-inflammatory effect, and this is the most important again because it is used in the treatment of many musculoskeletal disorders and inflammations that are related with rheumatoid arthritis, osteoarthritis, ankylosing spondylitis, and gout. Antipyretic, it reduces all fevers, but it is not effective in raised body temperature due exercise induced. Like if it is exercise induced fever, then it will have no effect. Otherwise, it can reduce all type of fevers related to any other conditions. Can be cold due to fever due to cold, fever due to bacterial infection. So that's the main important thing for this. Then it has got an antiplatelet effect. Low doses, as we mentioned before, between 80 to 100 milligram per day are used prophylactically. Prophylactically means before the problem appears, we start this low dosage. Usually we do this for the heart patients. And that's why we already using these for a lot of like ischemic attacks and cerebrovascular strokes. And in those suspected patients, we start with a very low doses every day. Also for prophylaxis of unstable angina and MI, that is myocardial infarction. Also thrombosis after coronary artery bypass grafting. This is a thrombosis after the surgery, post-op. And this is very advanced sort of surgery. And whenever we are doing some grafting within the vessels, after that, it may happen that there is clot formation or thrombosis. And for that reason also we can use aspirin. Systemic mastocytosis. What is this condition? Actually, this is excessive formation of mast cells within a bone marrow, reticuloendothelial system, GIT, bones and skin. In this case, what happens, there is large amount of PGD2, like prostaglandin D2, that is released from the mast cells, and this causes severe episodes of vasodilatation and hypotension. Definitely, you all know, whenever there is vasodilatation, there is hypotension, pooling of the blood within the peripheral blood vessels. This prostaglandin D2 effect is resistant to antihistamines. Now, if we use antihistamines here in this condition, it won't work. So what will work? Aspirin and ketoprofen are useful in this condition. And what is ketoprofen? It is a form of brufen. It is belonging to the family of ibuprofen. Bartter's syndrome. This is a very rare disorder. Commonly, it is not seen. However, it is characterized by hypokalemia, hypochloremic, metabolic alkalosis. Like whenever there are low levels of chlorine ions, then we say that this condition can be metabolic alkalosis that is related with the low levels of chlorine ions. And sometimes blood pressure remains normal in this condition. But however, there is hyperplasia of juxtaglomerular apparatus, like increase in the number of cells and thickening of the cells can occur. There is functional mutation in sodium potassium 2 chloride cotransporter in ascending limb of loop of Hadley. Actually, this cotransporter is helpful in exchange of ions. Then renal COX-2 is induced. Synthesis of prostaglandin E2 is increased. Treatment with NSAIDs along with spironolactone is very useful. So this is how we treat this condition. That renal COX-2, how it is induced by the help of NSAIDs, and usually we use spironolactone. This spironolactone is actually a diuretic. It can help along with the aspirin. Cancer chemoprevention. Frequent use of aspirin associated with 50% decrease in risk of colon cancer. Niacin tolerability. Niacin is actually, what is niacin? It is B6, large doses of niacin used to reduce serum cholesterol. However, it induces intense flushing by release of prostaglandin D2 from the skin, which can be inhibited by use with aspirin. So this is actually, we call it niacin tolerability. Closure of patent ductus arteriosus. Prostaglandins implicated in maintenance of patency of ductus arteriosus. They help in the patency at birth, and indomethacin and other NSAIDs have been used in neonates to close inappropriately patent ductus. Patent means when it is open, so it must be closed. So that's why we use these certain drugs for the closure of patent ductus arteriosus, because if it remains open, then there are a lot of complications that can come across. Also for the topical uses, we use salicylic acid. It is used for the treatment of warts, corns. These warts and corns, they are actually hard surface growths over the skin, and sometimes they're very painful. So for that reason, we are using salicylic acid in the form of creams, ointments that can be used. We call them corn caps. These corn caps are enclosed with this medication, and whenever they are applied, they can relieve this condition. Also fungal infections and eczematous dermatitis. Dermatitis is inflammation of the skin, and this can erupt in the form of water coming up or discharge coming up from the skin. Then there is another form that is known as methyl salicylates. They are known as oil of wintergreen. This is used as counter irritant for the relief of mild musculoskeletal pain. So it is again used as a topical application, and then it is, when applied, it relieves the pain. What are the common adverse effects? They're very easy to understand now. Just it's the listing, like CNS, headache, tinnitus, is ringing of the ears, vertigo, confusion and dizziness, CVS, fluid retention, hypertension, edema. Rarely CCF can occur. That is cardio CCF. You all know it is the congestive cardiac failure. GIT, abdominal pain, anorexia, nausea, vomiting, diarrhea, ulcers, and bleeding. Hematological complications can occur, but however, they're very rare. In fact, it is thrombocytopenia, neutropenia, or even aplastic anemia. Hepatic adverse effects, abnormal liver function tests. They are abnormally raised, and rarely liver failure can occur. Pulmonary asthma in sensitive individuals, rashes, pruritus, urticaria, flushing can occur. And among the renal complications, renal insufficiency, which is renal failure, hyperkalemia, salt and water retention. This ultimately can lead to edema and proteinuria. Because you all know that whenever there is edematous condition in renal failure or renal insufficiency, it is mainly due to proteinuria. Protein loss is occurring from the body, and hence there is edematous areas. Usually this is can be periorbital around the eyes, or it can be in the lower limbs. Reye's syndrome. This Reye's syndrome is associated with use of aspirin and other salicylates. This is one of the syndrome. This is actually not that much common, but still they say that this can be due to one of the adverse effects of aspirin and other salicylates. It occurs when aspirin is given in children and young adults less than 20 years with fever associated with viral illness. This is actually characterized by acute onset of encephalopathy, liver dysfunction, fatty infiltration of liver and other viscera. We call it a triad. Triad means a triangle. Like three things cause this Reye syndrome. Number one, encephalopathy, liver dysfunction, and fatty infiltration of other viscera. And basically, this is a viral infection. Acetaminophen, not associated with Reye syndrome. Acetaminophen, we say paracetamol. It is not associated with this condition, and it is a drug of choice for antipyresis in children and teenage children. Now, if very high doses of aspirin are administered, it can cause toxicity, and that is known as salicylism, in which this list of complications can happen, like headache, tinnitus, dizziness, hearing impairment can occur, dim vision, confusion and drowsiness, sweating, hyperventilation, nausea, vomiting, marked acid-base disturbances, hyperpyrexia, dehydration, cardiovascular and respiratory collapse can occur, and coma, convulsions, and ultimately death can occur. This ends with death because you see a lot of complications are happening here. How we manage the salicylate overdosage or poisoning. We usually admit the patient, we wash the GIT contents by gastric lavage, activated charcoal is used, we try to correct the electrolyte fluid acid base balance at aggressive volume repletion with IV fluids, because in this case patient is dehydrated, so we are using a lot of IV fluids to replace that dehydration. We keep the airway patent, decrease body temperature by cold sponging. Vitamin K is administered through IV route for correction of hypoprothrombinemia. And if there are convulsions, we can control with the help of diazepam, and it is administered through IV route. Also, it can promote excretion of salicylates by sodium bicarbonate, which can act as an antidote in this case. This can also be given through IV route for alkalinization of urine. This maintains pH at 8. Also, hemodialysis in patients with severe acidosis and coma. We can go for hemodialysis, but this is in that condition when the patient is ending with acidosis and going into coma. What are the contraindications? Children with viral infections. We should not give this drug with children with viral infections in pregnancy and hypersensitive patients. Thank you for your attention and listening.